Guys, welcome to my YouTube channel Ayurveda Basking. So first of all, a very thank you to all of you who have responded in my Kriya Shira video, and maximum of you have some doubt and some have like a Rachana Shira practical. So they are asking about this Rachana Shira practical. So today in this video we are going to see our Rachana Sharira anatomical practical through our university point, and all the point we will be covering. So again in this video there are two portions there. First is this video. In this video, I am going to tell you how the 200 marks of anatomy practical is distributed, and in a particular topic what question they can ask. I will highlight only those important points. And second, the important thing is the PDF that you have already seen our Instagram page. So in that PDF, all the like maximum of the bone are there with their attachment, then along with some Ayurvedic portions are there, sandhi is there, joints are there, marma are there. So the image specific will be there in that PDF. So let's start our this video. So first of all, again, this is total of 200 marks. Let me mark it. So it is a 200 marks practical, in which you have 100 marks of practical, 70 marks Viva, 30 marks for internal assessment. Okay, is that clear? Then first part, we have 20 marks for sporting. Sporting is there. 20 marks for Koshta and Ashya related portion. 20 marks for Asti, Sandhi, etc. 20 marks for the Marma portion, and 20 marks for the record. And this is your 100 marks. So out of this, your record is already you have submitted or you have completed and taken sign from the respective faculties. So other this 80 marks portion we are going to cover in this video, so that you can get maximum of 60 plus marks out of this 80 portion. So first of all, sporting, it is basically of 20 marks, and in each portion there are some specific question. So I am giving this PDF. You can easily go through the PDF. I will upload on the Telegram channel, and for again that instrument video you have to comment the PDF. So first and important things is that for this question paper, the first topic is Garbha, Sira and Kala. So here three terms are there: Garbha, Sira and Kala. And the important thing they can ask are Dristanta or metaphor, means the similes. Okay, our acharyas are so much intelligent, so whenever they explain any topic, they have given some simile so that we can understand that things easily. In our syllabus also, they have given one example. For example, Gunja Pala is a simile for Artava that is mentioned in the Shuddha Artava Lakshana, and Saptika is a simile for the Shukra that again mentioned in the Shuddha Shukra Lakshana. So like that, they can put Shukra images or like with modern correlation with sperm or ovum, and they can ask identify the image and write its Drishtanta. So first part for the identification, second for the Drishtanta. So respective thing like from Garbha, Shira and Kala, I have added here all the essential thing. Maybe the Rajas they can ask, and Rajas the comparison is the Ritu Kala, like a river in the monsoon, the periods period. Then Artava, Acharya have like correlated with the Agni Guna because it's having a Aganya Guna. Similarly for Shukra is basically because Shukra is unreactive up to the puberty stage. So Acharya has mentioned Pushpa Mukula Shatha, means up to puberty it in a Mukula stage. After that it will develop into the Pushpa stage. Then it is a very important for Garbhasya and Yoni. For Garbhasya, Acharya have mentioned like it is a kind of a receptacle or the nest which so nourishes the baby, and Yoni is third artva for the fetal support. So for this, Acharya Shushruta have given one important simile, that is Rohitam Matsya Mukham, mouth of a Rohita fish. Acharya Shushruta has mentioned uterus cavity simile with this Rohita Matsya Mukham. And for Yoni, Acharya has mentioned conch shell navel or Shankh Nabi Akriti. Okay. Then in Kala, all the Kala don't have that much simile, but some of Kala have simile, and the worst is the Raktadhara Kala. This point actually, if you have already studied, then it will be a revision. But for more convenience, you add this point in your notebook or in book so that whenever you study this portion, this point will recollect you. Then Raktadhara Kala It is actually compared with the latex yielding tree, that is a Shira vriksha. Just as milky sap comes out when the branch of such a tree is cut, blood oozes from the Raktadhara when the muscles are incised. The same is simile is given for the Raktadhara. Then for Mamsa Dharakala Acharya is mentioned, it is compared to the lotus stalk fiber or Bisamrinal, the vessel like Sira, Dhamani, Srotas spread through the mamsa, similar to the fiber of the lotus stalk. Then for Sleshma Dhara Kala, that is a fourth kala, it is compared to the oil in a wheel axle. Just a wheel moves smoothly when it is oiled or lubricated properly. The joints are supported or facilitated by their mucus layer, which we mentioned the Sleshmaka kapha and all. Then for Shukradhara Kala, that is the seventh Kala, Acharya is mentioned as butter in the milk, jaggery in the sugar cane. So this indicates the presence of the Shukra throughout the body, as butter is present in all part of the milk and it's maybe not visible, but it's distributed all over the body. So these are the some important Drishtanta that Acharya have mentioned. Okay, next important portion is Marma. For this Marma, I will show our the PDF portion to you. So as I have already told you, this ovum and sperm are kept for the simile portion. This is our muscle attachment portion. Next, which I have to show you is the Marma portion. Okay. So for the Marma, I have added some important tabular form. Here is table. For example, this is the Marma of the Shiras. Okay, so you can see this is our Sthapani. I will mark some important Marma. Okay, so here Sthapani is there, which you can mark it. Many time it will come in exam because they can put one picture or something like that and they will mark one area. For example, one face picture will be there and they will mark this area. Then they can ask identify this Marma and related question. Then this Avrata and Apanga is important because this can easily identified. Sometimes Utakshepa and Shankha is also asked. Adipati is also important. Then after this diagram, you can see this table. This table is actually very important because in Marma the sub question is somewhat difficult because there are many Marma. So for all those things we have difficult in remember. So if you go through in this table, you can quick revise them. For example, if Utakshepa come and they can ask what is the Prinama or Primana. So if you have this table, you can easily identify Utakshepa comes and then its Prinama is a Vishalya Ghana Marma. Okay. Then is Prinama is it is a half anguli. Then what is the Rachana? It is a Sanayu Marma. Okay. Then what is the correlation with the injury? So temporalis muscle and fascia. So patient survive until the foreign body is inside the wound. That is Vishalya Ghana Marma. Whenever we remove that shalya, the patient will die because Vata Prakopa and all. And this number is 2. Its Shadanga or its location is the head. So like this, all the point for that particular Marma is completed here. So when you study your Marma portion in this PDF, you can use like this. Okay, here I have added all the Marma. For example, this is our head and neck Marma. Then this is our back Marma like Katik, Tarunha, Kukundra, Nitamba, Parshva Sandhi. Then this is our Amsha Falak, Amsha Marma. And again this is our neck Marma like Neela Manya, Matrika, Kritatika, Apanga. And after that this is your Shakha Marma, Ani, Bahavi, Lohitaksham, Kakshadhara. This is your thorax Marma, Hridyam, Stanamulam, Stanarohitam, Apalpa, Apastambha. And this table is you can remember from, and I have added one picture also here. If your like lab have because they go in syllabus they have given so many point, but the same things how the teacher can ask you which resources they have. If they have a pictures of the single Marma, they can ask single Marma, or they can make some pictures or like this images. If your anatomy have, they put like this and they will mark X or something dotted like structure, they will ask ma identify the dotted or X structure, and the respective question like what will be the prinama, what is the primana, how many are there, and what is the clinical correlation, what is the clinical importance. So like that question can come. And in this PDF, what are the important things? अधिपति again आपका important हो जाएगा. Then your like these are the main stannarohita, stannamula. We can identify it's above the nipple, that is stannarohita. Below that is stannamula. Then rhythm is important. Then shakha marma is more important because many times they ask, for example, tala hridam, shipram. Then indravasta is very very important. Manibandha, nabhi, because they can easily identifiable. Okay. Then avrata, utakshepa, apanga, viduram. Then here your Stephanie is important. Then Urvi is important. Then Ani, Janu is important. And in back, Viduram is sometime important. Like it's asked sometime. Then your is here Nitamba is important. And this Amsha, Palak, Amsha, Vrihiti, Karp. These are the important marma. Okay. So, Marma, I have already told you all the things. So here what they can ask identification and type. In second type of question, they can ask you what is the identification. First, actually in anatomy, first you have to identify this thing. If it is a bone, which bone or which side? Like left side, right side. If it is an organ, if it's a pair, then right or left, or identify which organ. Same which marma it is this. Then what is the pranama, anatomical structure. Then they can ask identification and vida lakshana. Vida lakshana means if injury happened to that particular marma, what will be the lakshana. Then up to here is your marma portion, and all important point we have already covered in that PDF. Okay, so you simultaneously go through that PDF so that you won't miss any single point. Next important topic comes is your bone and muscle. Actually, it is somewhat difficult for many students because here so many bones are there, and if you have already studied the cadaver study in your clinics, then it will be more tough for some students. In my college, we have gone through cadaver dissection and all, so proper dissection classes are there, and we have attended. And I have added maximum cadaver images, but we can't take the photo of the cadaver, that is against the ethics. So those pictures actually I took from the Google, but it will be helpful for you guys. If you didn't done this dissection and all, then they will ask in the paragraph form like this is the structure, or explain like some area also. For example, popliteal area they can ask, then cubital fossa they can ask, then femoral triangle. So like there's some particular terms are there in anatomical area, then they can ask those things. Okay, according to that how they teach you, they will ask it. Okay, so here bone and muscle. So in bone and muscle, I will again show in that PDF. I have added the maximum bone which have repeatedly asked. Here you will note maximally asked bone is pelvis is very very important. So uh, very nicely understand the right or left pelvis, how to identify it. Maximum the important is skin muscles attachment and all. Then hip joint it's coming now. So how the hip joint form. Then femur, the examiner favorite bone, you can say. It is a very very important. It's come in exams also. It is very important. So femur, how the hip joint is formed. Then femur's muscle attachment. Okay. Then after that, shoulder joint. So shoulder joint is important. And here scapula. Scapula is actually a easy bone, and it is easily under we can easily define it. So again side you have to know it is a left scapula or right scapula. Then is muscle attachment. Then comes your humerus, again important. Then after humerus, radius and ulna. Sometimes they kept, but generally more deeper question won't be asked from this portion. They just can ask identification and all. If they teaches you so nicely, then they can ask the deeper question also. Okay. Then patella is important because sometimes they can kept it is a right or left patella or the muscle attachment. Then Uh, tibia and fibula is also important. And oh, one important one is clavicle. Okay, clavicle is also important because it's having so much significance. So that's why it's very important. Then facial muscles are facial bone are also there. But if in your college they didn't like give you for study or anything like that, you can skip it. But if they have already taught you, then you should just go through the small bone also. And up to here, that is most important. Okay, like this carpals, metacarpals, tarsals, metatarsals are not that much coming. Okay, like some may become, like for example calcaneus, that is having some clinical importance that can come. Others are not that much coming frequently. Then in the spinal cord, atlas and axis. Okay, atlas and axis. Because they have a special process in that. So these are the important bone that maximum time they will ask. First question in the bone is again identification is the question, then peculiarities. Okay, they will mention in that context which kind of peculiarity you have to say. Then again, here they have given one example. For example, the atlas vertebra. What is the peculiarity? So I have already told you. In cervical vertebra, there is a even extra processes. You have to comment the name of the process in the comment section. That's why that may become the peculiarity of this kind of vertebra. Then second is again identification and attachment. So here they can ask the identify the scapular spine and the attachment. And then next from the bone is the side determination, and some specific point will be there. Again identification and applied aspect, again important. Then in our Ayurveda, it is related with the asthi and all type now. So here they can ask some correlated thing. For example, they can give any long bone, and in our Ayurveda it is known as a Nalaka Sandhi. So they will ask tibia, then its Ayurvedic name is a Nalak Sandhi, and it's a long bone. So like that they can ask question. The next portion is I indicated the muscle portion. So for the muscle, they can give any bone and identify which muscle is attached here, or identify the muscle attachment, or in that muscle we have to give that origin and insertion. So okay, so muscle identification, origin and insertion, one mark. Then if it is a muscle, then their action can be asked like adduction, abduction, flexion, extension, which action will it will do. Then again, if it's a muscle, then blood supply and nerve supply is also important. Or anatomical identification, how you can identify. Same question can come in cadaver also if you have studied. Then identify the bone and its process. So generally processes will come only those bone who have processes. Okay. And identify the bone, right? It's to angle. Okay. So this is also important. Here one example is given. Bone process are named based on their shape and location. For example, tuberosity. So some bone we have deltoid tuberosity, tibial tuberosity. So that portion can come. So deltoid tuberosity found in the humerus. Then condyle, a rounded protuberance at the end of small bone that's found mainly in the occipital condyle. Then spine process, and it's found mainly in the spinous processes of the vertebra. Then crust, like iliac crust of the pelvis. So like this, some bone specific processes they can ask with identification of the bone. Then next is the peculiarity. Here for example, hip bone is special, I have already told you, because they actually help in the gender identification also, pelvic bone and clavicle. Then up to this is our bone portion. Now I will show in that our PDF what are the important point we have to need. So here you can see this is our scapula bone. In these images, I will tell you one thing. The red line is indicating the origin of the muscle, and blue line indicated some muscle is insertion there. Okay. So for example, this is our spine of the scapula, as you can follow this cursor, and above this is your supraspinatus. Okay, and below this your infraspinatus, origin of the muscle. Then this blue line on this scapular spine is giving the insertion to the trapezius muscle. So like that you have to study, and I have you already studied this portion because this already come in your theory paper, so we are not going in detail, but I am giving the images and that you should know and at least look through. Then this radius and ulna is here. Then again, this is important. The femur and pelvis are very very important. They will surely come, or they can repeat one or two times in your practical sporting and all. So try to remember all the muscle attachment of this femur and this pelvic also. Then next is your tibia and fibula is here. Actually, tibia and fibula is not that much asked, but tibial tuberosity is one of the question. Then soleus 9. So these are some of the important key heading that they were popliteus insertion. Then in our Ayurveda, actually, for this asthi, Acharya have given one classification based on their some shape. For example, first one is your Kapala Asthi. Kapala Asthi, I have written some example. So they can ask like this kind of question. For example, Nitamba comes in the Kapala Asthi. So they can give you pelvic bone, or and they will ask, I write the Ayurvedic name and the modern name. And same, for example, skull bone are also coming in Kapala. Then teeth are coming in the Ruchik Asti. Tarun Asti is basically your cartilage, nose, cartilage, ear, cartilage and all. Valla Asti is basically your rib and all. So, thoracic cage and lateral bone of the thoracic cage comes in the Valla Asti. Nalak Asti is your long bone. For example, like your bone of the हस्तपाद अंगुली तले कुर्चेषु मणिबंध्यो बाहु जंगाद्यो चापे जानियात अन्य कालानि तुइति. तो इसमें हमारे पास ये बोन सब आ जाएंगे. अगर हम बोन के नंबर की बात करते हैं तो ये वैसे तो एमसीक्यू पॉइंट रहता है कि चरका के अकॉर्डिंग 360 है, अष्टांग के अकॉर्डिंग अगेन 360 है. ओनली वेरिएशन कहाँ आता है? सुश्रुत समिता और भाव प्रकाश के अकॉर्डिंग जिन्होंने 300 बताया है. Then patella, important bone. Skull bone I have written. Then this clavicle. Then up to this is your bone portion here. Next we come on the joint portion. So again joint portion. In the joint, ligaments are important. So okay. So the identification ligament, identification action. Then identification with their Ayurvedic and modern portion, their clinical anatomy, and their relations are also important, sometimes confusing also, but try to at least remember for the major and important joint. I will give the name also for those. Then some movement along with the muscle involvement, this is important for the joint portion. And in joint, the most importantly asked joint is your shoulder joint, then your elbow joint, sometimes wrist joint is also there. Then hip joint is very very important, knee joint is very very important, ankle joint and somewhat also important, TMJ joint. Mainly these joints will be asking. Let's see that portion in our P. So as you can see here, and the Ayurvedic portion is again here some classification is there. For example, Kora Sandhi is there, and Kora Sandhi, this actually you already know this thing. I'm just revising. Okay, so Kora Sandhi, the example is Anguli, Manibandh, Gulfa, Janu, Kurpura, and these are the photos you can see. Then Ullakhal Sandhi comes under Kanksha, Vanksham, Dasaneshu are example. Then for this Samudgam is your Amsapidam, Guram, Bagam, Nitambam. Then for Paratara is Griva, Prishtamsham, Tunna Sevani, Mandala and all. So these are some example. This is your elbow joint, as you can see the lateral in the front view. Then comes your this is your hip joint, knee joint, and shoulder joint, ankle joint, wrist joint. So these are the joint and bone that I have already shown to you. Next, this is your actually organ portion. So in the organ portion, what they can ask first is identification and Srotas. For this, I have added one important and beautiful paper in that like a PDF portion. In that, all the Srotas are there along with their Sroto Mula and all. So this question will be going through that PDF. Then organ and name of the kala related to with that organ and their utpatti. For this utpatti, this is the important table. You should see this. For example, Acharya have mentioned Yakrita utpatti is from Shonita, Pliha utpatti from again Shonita, Fufusa utpatti from Shonita Fenaha, Unduka utpatti from Shonita Kitta. So sometimes they can kept your for example lungs they kept, and they will ask identify the it is either left or right, identify the organ with this side, and from which part its utpatti is mentioned in the classics. So right answer will be the shown in the vena. Then along with that they can ask some visceral impressions which our organs have, anterior, posterior, lateral and all. Then along with that is blood supply and nerve supply. It's bordered, specially bordered organ like your liver, mainly this liver and all ask for this or portion. Then surface anatomy up to here, and the last portion is your applied as. So here as you can say, this is your brain, this is your stomach, this is your lungs. Then after that I will show that PDF also to you guys. And this is your lungs, this is your kidney, and this is the important PDF for Srotas and all. For example, Prana Srotas has a Moolasthana, Hridaya and Mahasrotas. So sometimes they will kept Hridaya and they will ask what is the organ, identify the organ and identify the Srotas related with this. So Hridaya is a Moolasthana of Prana Srotas. Along with that is also a Moolasthana of Rasa Srotas. So like that you have to give answer for that particular question. So next come the radiology. So radiology, not that much tough questions are there. Simply, first of all, you have to identify which joint are seen in that particular graph, X-ray graph. Then after that, you have to identify it is a AP or a PA view. Then if any special thing like uh, any obstruction is there, if you can identify, you can write those things, or you can write the related structure you can see in that X-ray. Identification and structure, then identification and structure is basically there. Then from the central nervous system, surely question will be there, and specifically your cerebrum, like lobe and how many lobe are there, this kind of simple question are there. In sense organ they can kept any organ. Generally we have some models in our anatomy lab, so sometimes they will kept that particular model. For example, in my paper they kept tvacha, they kept one tvacha layer. Like for example, this kind of some models are there in which like 7 layers are there for tvacha. So they kept those things and we have to identify it, and this respective question is there. Similarly, they can kept tongue and identify the supply of this particular sense organ. Then after that they can ask them applied aspect also. Then in Costa Asya Shariram dissection organ. So dissection again I have already told you. The same thing will come in. In dissection mainly they can ask your muscle, nerve supply or blood supply. In that PDF I have already added all the important things that you should know from the dissection point. So you can go through that PDF. Then in histology slide, I have added those slides that in our college we usually use. This is liver, pancreas, ovary, thyroid, testis, okay. This is the same. So you when you got this PDF, you can repeat it and revise it. Then Asti Sandhi Peshi Bone we have already completed. So this is our sporting we have completed. Then practical record is for 15 marks, 5 marks for communication skills, so total 20 marks. And here we have completed our 100 marks portion for the practical exam. Now we go through the Viva. So Viva again 70 marks Viva is there and 30 marks internal assessment that has already calculated and uploaded for you. For that Viva, actually what happening? So there is a mark distribution, 40 marks, 20, 10 marks. So Sira, Dhamni Srotas, Sharira Upkarmiyan Sharira, Paribhasha Sharira, Pramana Sharira, anatomical terminology, Kala Shira, Indriya, reproductive system. From this part, they can ask definition, they can ask type, or they can ask the number or planes, part or shloka. For example, they can ask the shloka for Kala Sharira, or they can ask how many Kala are there, or they can ask then Kandara, Kurcha, all those things. Okay. Second, the important part is comprehensive question. So comprehensive question is generally comprehension related. For example, modern portion, nervous system, endocrine system, lymphatic, cardiovascular, urinary. From this part, they can ask relations, blood supply, nerve supply, venous and lymphatic drainage. Okay. So like this question can be asked from this portion, modern. Then in third part is application question. So here they can ask Garbha, Sharira, embryology, respiratory system, digestive system. Applied anatomical question can be there. Surgical anatomical question, congenital anomaly, and like that. So up to here, your 70 marks Viva will be there, and 30 marks already completed for your internal assessment. So again 100 marks we have already completed. So this is a total of 200 marks. So here our Rachana Sharira practical exam discussion will be over. I hope this will be helpful for you guys, and if you like it, then save it and share it. And all the very best for your exam. Be calm and at least study the portion that you have written your exam, because sometimes the new cheese we can't easily learn it or remember it. But if you have already given the theory paper, so you have an idea of your syllabus, what is important, what is MK, what is TK. So at least try to remember those your short notes or the topic you have studied for theory exam. And all the very best for your Viva. Thank you guys.